Hello, everybody. My name is Minnie Downey, and I'm the Vice Chair of Canada-India Network Society. On behalf of our Board of Directors, it is my pleasure to welcome you to Canada-India Network Initiative 2021, otherwise known as CINI 2021. I want to say a special good morning to our guests and speakers that are joining us from India, and good evening to our guests and speakers that are joining us from here in BC. And a warm welcome to guests from all the other time zones in between. We are very pleased that you have joined us for this virtual conference this year. First, I want to acknowledge that I am joining you from New Westminster, British Columbia, and it is my privilege to host this meeting from within the ancestral, traditional, and unceded territory of the Coast Salish people. On Monday, June the 21st, our summer solstice, is National Indigenous Peoples Day. This is a day for all Canadians to recognize and celebrate the unique heritage, diverse cultures, and the outstanding contributions of our First Nations, Inuit, and Métis peoples. It is also, as we gather at this conference from India, Canada, and from around the world, to acknowledge the celebration of India 75, the celebration of India's 75 years of independence. At CINS, we are very proud to be bringing you our 4th CINI conference and our first virtual conference. We are actually celebrating our 10-year anniversary. And each conference that we've had over the past has been work built on previous conferences. And this year's theme is lowering the burden of chronic disease through integrative thinking, voices from the trenches. Over the next 3 days, you will hear examples of the fusion of external and internal interventions to build sustainable health and a healthy civil society. At CINS, we work to build links between Canada and India through engagement, social innovation, and technology. We conceptualize, collaborate, and coordinate between people, organizations, and institutes. We cannot and we do not work alone. It is only with our many partners and collaborators we are seeing the impact of our work. And we thank each of you for all contributions and contributing to the success of the CINS and our work. We have a great lineup for the next 3 days. Starting with this evening, we're going to hear some inspiring messages from our partners, and we're going to have a fascinating talk on integrated medicine. And then tomorrow, there's going to be some real life examples, some projects that are occurring in Canada and India, and that they're really making a difference. And I think this is what it really comes down to, is being able to see the actions that's actually occurring right on the ground. And Sunday is a focus on yoga and practical ways to integrate its health benefits into your life and wellness. And I'm really looking forward to that one. I think I'm going to learn a lot, and hopefully I'll be able to implement that into my routines. Before we get going, housekeeping. We will be selecting 3 people at random to win a prize at the end of each day, and the requirement is that you must be in attendance at the time of the draw. And at that time, we will arrange to have the prizes shipped to you. Also, we are on Twitter, so please look at the chat room to see the hashtags, as well as they've been flying by. And we will also have a prize for the person who has the most tweets each day, and we will mail that out to the winner. We're going to be monitoring the chat room, so please go in there, have some fun, write your comments, and ask your questions. Additionally, we will be monitoring the chat room and picking some questions that we will ask to our speakers. We ask that you please keep your microphones muted, and we have our tech people behind the scenes that will assist there. You're going to hear a lot of information over the next 3 days, and the information that's being provided is intended to be used, is intended not to be used for any medical emergency or diagnosis or treatment of any medical conditions. And we advise you to consult with your licensed physician or practitioner for any diagnoses and treatments of any medical conditions that you might have. And as was noted at the outset, this event is being recorded, and this may be used for future promotion events and educational purposes. Without further ado, we are going to jump right into our program for this evening. As I mentioned earlier, we're really an organization about collaboration and working in partnerships. And it is my sincere honor to have Vancouver Consulate Government of India and co-host for this evening's event, Counsel General Manish. Over to you.
Thank you, Minnie. Honourable Adrian Dix, Minister of Health of British Columbia, His Excellency Ajay Bisaria, High Commissioner of India to Canada, Dr. H.R. Nagendra, Chancellor, S. Vyasa, Dr. Arun Garg, President and Chair, Canada-India Network Society, Directors and Advisory Board Members of Canada-India Network Society, distinguished participants, ladies and gentlemen, Namaskar and greetings from Vancouver. Good morning to India, good evening to Canada. I extend a very warm welcome to all on behalf of High Commissioner and on my personal behalf in today's event titled Lowering the Burden of Chronic Disease Through Integrative Thinking. As you all know, the event is being organized by CINS as part of its Canada-India Network Initiative 2021. It is a 3-day event culminating with a yoga demonstration on 20th June. As you all know, this event is a very timely because it coincides with the 7th International Day of Yoga. And Government of India has announced this year's theme as Yoga for Wellness. CINS mission statement is to build links between Canada and India through engagement, social innovation, and technology. The current initiative is an effort to bring the best of India and Canada for holistic healing of chronic diseases. Today, we have a galaxy of experts like Dr. H.R. Nagendra in the field of yoga research, academics like Joy Johnson, Dr. Joanne Curry, Ms. Kathy from the field of medicine, Dr. Anupam Sibal from Apollo, Dr. Victoria Lee from Fraser Health, Dr. Allan Davis and others who will be speaking and sharing their valuable insights on the subject. CNI and Dr. Garg has been associated with Counsel and its yoga outreach activities for many years now. One of the highlights I would like to inform the audience here is the collaboration came in 2019 during the visit of Dr. H.R. Nagendra to Vancouver, when we hosted a roundtable at the consulate in which Minister Dix also participated to discuss the benefits of adopting yoga as part of the mainstream health and wellness program of British Columbia's health system that could potentially lower the burden of chronic diseases. We can see that CINS and SVASA can have a major role in this to play in this project. Minister Adrian Dix, Health Minister, has been taking personal interest in the concept of integrative approach to alleviation of chronic diseases in which yoga can play a vital role. I would also acknowledge the efforts and hard work put in by Dr. Garg, Ms. Minnie and other CNIs in conceptualizing and bringing together on this platform all experts for an insightful exchange of views. The High Commission and the Consulate are privileged to have partnered with CINS on this virtual IDY event, which is also taking place at a time when we are celebrating 75 years of India's independence. I have now the honor to introduce my High Commissioner, His Excellency Mr. Ajay Bisaria. Mr. Ajay Bisaria has been the High Commissioner of India to Canada from 1st March 2020. He is a career diplomat with over 34 years of diplomatic service and experience. He has a solid educational background, having studied in premier educational institutes in India. He has a bachelor's degree in economics from St. Stephen's. He has a master's degree in business administration from IIM, and also a master's degree in public policy from Princeton University, US. Prior to joining the diplomatic services, Mr. Bisaria has worked briefly in American Express Bank as well as Bharat Heavy Electricals Limited, a PSU, in New Delhi. During his diplomatic life, he has served on important desks within and outside Ministry of External Affairs. He has specialized in Eastern European and Eurasian affairs. He has served in Ministry of Commerce, Prime Minister's Office, and also in the World Bank. Among overseas assignments, he has served in Moscow and Berlin and has been our Ambassador of India to Poland and High Commissioner of India to Pakistan, He has assumed office, as I said, in Canada on 1st March 2020. He's a rank of Secretary to the Government of India. And before coming to Canada, he also represented India's team to the UN Human Rights Council in Geneva, representing India's interest in Human Rights Council. Now, with the permission of the chair, and I would like to invite High Commissioner Bisaria to deliver his remarks. Over to you, sir, and thank you, everyone. Have a pleasant evening.
Thank you very much, Manish. Thank you for the introduction. Namaskar and welcome to all the guests joining this wonderful event today. It's a privilege to be part of this. Very good evening to everyone in Canada. I'm in Ottawa, where it's about 9:45 in the evening, a little earlier in Vancouver. And very good morning to all friends and colleagues joining us from India. This is such a privilege to be part of the fourth edition of this CINI dialogue. First of all, greetings for the International Day of Yoga weekend that is coming up. That is what we are celebrating. I think this is a very well-timed event because we are celebrating multiple milestones at this point of time. This is also greetings in advance to our friends in Canada on the Indigenous Peoples Day on the 21st of June. Thank you for mentioning the 75th year of India's independence. We are celebrating India at 75, and also, of course, 10 years of the Canada-India network. So all wonderful events to celebrate. And I think we are also at a propitious time in terms of the ending of the brutal second wave of the pandemic in India and the unlocking going on in Canada after the receding of the third wave. So we just hope that trend of the pandemic continues, and therefore this is a good time to talk of healing and healing methods. It's a very appropriate subject that you have chosen. I think integrative approach to medicine in health and wellness as part of this two-day event, and lowering the burden of chronic disease through integrative thinking, I think is something of great relevance in these times, and particularly when the focus on public health is very strong as we continue this ongoing global struggle against the pandemic. Talking of what happened in India, we went through a brutal second wave out of which we are now emerging and unlocking the Indian economy and moving on towards a more normal situation in India in terms of dealing with the public health crisis and then the subsequent economic crisis. The learnings for India from this crisis are very relevant to the rest of the world. We are all in this together, and this is something which all of us are drawing lessons from what has happened. Our first important lesson, I think, is that the tool that the world has at this point of time is vaccinations, and vaccinating is very, very critical to getting out of this pandemic, and that is what modern science has offered us, and that is what we are all deploying in our national territories. Also, the lesson is to open cautiously. We are watching the numbers, following the science, and looking at the numbers to ensure the degree and calibration of the unlocking process. The third important thing is to monitor the variants. The second wave in India was driven by several variants, including the Delta variant, which were more virulent, more infectious than anything we had seen in the first wave. And this is something that is important globally to keep monitoring the variants. Also, it is important to be able to scale up medical systems very rapidly when we are faced with a tsunami-like wave. This could hit any country in the world. We hope it doesn't. But the lesson is that we need to be able to scale up our medical systems in a rapid way. And also global coordination is very important in terms of both monitoring the variants, but being able to provide medical supplies and medical assistance where it is required. So I think this is essentially what we are learning, is that we're in it together, and India and Canada have realized that this more than most other countries, that what it is to be coordinating during the pandemic. We have coordinated very closely right from the beginning. India had supplied medicines to Canada right in the beginning in 2020 as part of the efforts of being the pharmacy of the world, and getting in early medicines like hydroxychloroquine and paracetamol. Subsequently, India coordinated with Canada in terms of supplying vaccines to Canada in March this year, and 500,000 doses of AstraZeneca vaccines had come. And now we have a very good news in the last 2 or 3 weeks of a joint Indo-Canadian vaccine in terms of a collaboration between a company based headquartered in Vancouver and producing in Manitoba, Providence Pharmaceuticals, Providence Therapeutics, which has coordinated with Biological E to produce messenger RNA vaccine in Hyderabad, which, as many of you would know, is known as the vaccine capital of the world for the number of vaccines makers and vaccines being made there. So I think that takes us to a next and very important phase of our cooperation. India is running the largest vaccination program in the world. 260 million vaccines have been administered already. And the hope is to, by August, administer 500 million or 510 million doses of vaccines. And by the end of the year, to be able to vaccinate all Indians over the age of 18 by delivering some 2 billion vaccines. So India will continue to be the vaccine maker of the world, and India's capacities will be available to the world for vaccine equity, which is a very important objective for India, to be able to particularly supply vaccines to countries that don't have them. The other point I just wanted to make to a group like this is that one of the impacts of COVID has been on the healthcare approach globally, which has been to see with growing interest the alternative pathways to health and wellness. And we are seeing a dramatic change in how we approach our personal healthcare and how we approach our medical issues, and how we look at health in a holistic way, which is exactly what this conversation that we will have over the next couple of days is about. In India, we believe that the best outcome to healthcare is based on modern medicine, on alternative medicine approaches like yoga and Ayurveda, and all other medicines, medical approaches that have been practiced in India. Yoga and Ayurveda we see as ancient medical systems, but which are continuously being studied by modern science based upon evidence and research of modern science. These are being verified and updated continuously. So I think integrative medicine, which brings together the conventional and the complementary approaches in a coordinated manner, is based on the definition which is postulated by the WHO, addressing the full range of physical, psychological, social, and spiritual well-being of a person. I think that is exactly what we are talking of. What we feel is that yoga, since we're about to celebrate Yoga Day, is a composite ancient Indian technique which can aid in achieving wellness, harmony, and even social order. And in every conversation about integrative medicine, it is important to have yoga as a component of what constitutes an integrated approach. So I think the Yoga Day is a reminder for us, not just that India is a pharmacy of the world and will continue to be. India is now the vaccine maker of the world and will continue to be once we take care of the needs within India of being able to supply vaccines globally, but also that India would like to be the healer of the world in a more broad sense of what we are discussing in this conversation over the next couple of days. We are also looking at integrative medicine as something that is something that should be mainstreamed to be able to have medicine have a greater reach, and particularly among the poorer and less reached sections of India. So I don't want to go into any further detail and anticipate this conversation, but I do really look forward to the conversation we will have with our experts over the next couple of days and some of the outcomes, which I'm sure will inform us. And I only wish to thank all those who made this possible, particularly Dr. Arun Garg, President and Office Bearers of the CINS, and also Padma Shri Dr. Nagendra, and all other eminent personalities who have been so active in keeping the India-Canada Health Corridor and this India-Canada Health conversation going. And I wish CINS 2021 all success in your deliberations. Thank you very much.
Thank you, Counsel General Manish, for your welcome and for the introduction of His Excellency Ajay Bisaria. And also His Excellency Ajay Bisaria, thank you for that very inspiring talk, very inspirational, and really just highlighting the importance of the relationship between Canada and India. Moving on to our next speaker, it is my pleasure to introduce the Honourable Adrian Dix, Minister of Health and Minister responsible for Francophone Affairs.
Thank you very much, and it's wonderful to be here today. I'm speaking to you from East Vancouver. It's the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nation, and I'm truly honored to be here today. I wanted to express my appreciation to High Commissioner Bisaria, His Excellency, for his participation today, and really for our collaborations as jurisdictions and as countries in this year, 18 months, 19 months of pandemic, and all that we've done together. I think I also want to acknowledge my friend George Abbott, who's there, which gives me hope. I'm the Minister of Health for British Columbia, and George was the Minister of Health, and he's looking extremely healthy, which tells me that maybe there's hope for me as well. I wanted to acknowledge Consul General Manish, of course. I want to also acknowledge just finally the President of the Fraser Health Authority, Dr. Victoria Lee, who like me is a strong supporter of both Dr. Garg's effort and of the Canada-India Network Society. Dr. Lee is, in addition to all the other things she does, because the Fraser Health Authority, people don't know this, is the largest employer in British Columbia other than the government of British Columbia, with 30,000 employees. And she's organizing tomorrow a 24-hour vaccination marathon in Surrey. So it's wonderful to have her there as well, and you'll hear from her in a few minutes. I think this year tells us how connected we are, and you know, Dr. Garg, who's a mentor to many of us, I know to George and myself as ministers of health, he has provided regular and wise counsel, and we have, of course, I've been a regular supporter at these events over the years. But I think this period, this COVID-19 pandemic, tells us how the world is linked. And in many ways, the vision of Dr. Garg of bringing Canada and India together on health issues and wellness issues and engagements is many years ago, of course, and over the course of his career, but especially since the establishment of the Canada-India Network Society, really symbolizes in a way the kind of thing that we need, because we all know this, that this pandemic will not be truly dealt with until people around the world are vaccinated. We have a very high rate of first dose vaccination in British Columbia, and we're moving on second doses, but British Columbia is not enough. We have to be connected in the world, and we are. I know that the High Commissioner did not mention Pune, but since my wife Renee was born in Pune, I wanted to say that we do very much appreciate all of the work, especially that was done by the Serum Institute of India with respect to vaccinations, which has been world leading and has had a major difference, not just in Canada, but all over the world, and of course for the people of India. I want to wish you, I'm looking forward again to the results of this important conference. It informs our approach in British Columbia and to the continuing partnership that Dr. Garg has promoted between the people and the medical communities and the health communities of Canada and of India. Thank you for having me here tonight. And I want to also say, so I spoke to him a few minutes ago, just before I came in, to bring the personal greetings of Premier Horgan, Dr. Garg. He wanted me to say hello. And I wanted to bring his personal greetings to the event as well. Thank you very much. Have a wonderful event. And thank you for having me tonight.
Thank you, Honourable Dix. Yeah, and while you're here in your role as a Minister of Health, we want to also acknowledge that you've been a friend of Canada-India Network Society for a long time, over and above even your political responsibilities. So thank you very much. Moving on, it is my pleasure to introduce the director of the Apollo Health Hospitals in India, as well as the president of GAPIO in India. That's Dr. Anupam Sibal. He was hoping to be here in person today, but he messaged us last evening and he was not able to make it. So he has sent a video, so we're going to play his video message.
Namaskar, greetings from India. Today is day 507 of the COVID pandemic. Who would have thought 500 days later we'd still be discussing the SARS-CoV-2 virus? The pandemic has caused much devastation across the globe, but has also taught us important lessons. And one very important lesson is that we need to work together. Closer collaboration is what is needed. We need to build bridges. We need to break silos. We need to learn from each other. We need to talk to each other. We need to exchange ideas like we've never done before. GAPIO, the Global Association of Physicians of Indian Origin, was created to bring together physicians of Indian origin across the globe on one platform, and we today have members from 53 countries. GAPIO is privileged to be a part of the Global Indian Physician Collaborative that was established jointly by GAPIO, by CINS, CAPI, IMJA, API, and BAPIO. We've organized over the last 15 months several academic events, and realizing the importance of spiritual health, we've also been fortunate to have had several sessions on spirituality with Sister Shivani, with His Holiness the Dalai Lama, with Sri Gaur Gopal Das, with Sadhguru. And each of these has given a different perspective to us. Today, we are here together to discuss something that is so important, integrative leadership, and how that can help lessen the burden of chronic diseases. I'm so happy that the Canada-India Network Society has organized this path-breaking initiative. I want to congratulate the leadership of the society, the organizers of CINI, to have thought about this topic and brought all the experts to deliberate on the way forward. I'm sure this conference will be a resounding success and will help create a framework that other physicians and physician organizations can follow across the globe. Thank you for this kind invitation.
So great message there from Dr. Sibal, and they have been partners with us for a long time and have been instrumental in helping us to move some initiatives along in India. So moving along, we have greetings coming from Fraser Health Authority. Dr. Victoria Lee, the CEO. Fraser Health has been one of our founding partners right from the beginning and have co-hosted several conferences with us. It is my privilege to introduce Dr. Victoria Lee.
Good evening, everyone. It's really great to join you and privileged to join you from Surrey this evening. I'm joining you from the traditional unceded and shared territories of the Coast Salish people, specifically Kwetland, Coquitlam, Tsawwassen, and Semiahmoo and Kwetland, and Semiahmoo First Nations. So thank you so much for having me this evening. And I'd like to say a few words of gratitude, first of all, to Dr. Garg and the organizers of the meeting. Dr. Garg, as you mentioned, has been a critical and I think foundational champion within our system to ensure that we're looking at diversity and really looking at how we work together across not just within our organization, but across various global partners as well. And he has been our founding member of South Asian Health Institute within Fraser Health and has contributed greatly in our work throughout the time that he's been with us. And I believe he might be the longest physician that served in Fraser as a privileged physician within the organization as well. So a huge amount of gratitude to Dr. Garg and all the organizers, and of course with the Consul General and the High Commissioner and the Minister that had just spoken previously, Minister Dix, and Dr. Bonnie Henry has been our provincial leaders to lead us through the pandemic response and now into our immunization efforts and recovery, and very thankful for their strong leadership throughout this very challenging time. Many people have spoken about the fact that the pandemic has revealed how intrinsically and intricately connected we are from each other, whether we live in Canada or India or in Zimbabwe. We're connected, and the pandemic has really revealed both strengths and some of the gaps in how our health systems function as well. And while Canada and BC specifically is leading the world in terms of our first dose vaccine coverage, we know that until globally we're all covered, and right now globally it's around 10 to 15% of the population that's covered by COVID immunizations. We know that we're not all protected until we have our global partners all protected through the vaccine efforts. And I think unfortunately the pandemic has increased the inequities that we have seen in our health and other conditions. And as we have some of the things that we are expecting from the pandemic, such as increasing chronic diseases and tsunami of mental health and substance use issues and concerns, and socioeconomic challenges that are from the pandemic, I believe, especially during this time, it's important that we look at integrative leadership, integrative learning as we're doing, and also integrative healing. So really looking forward to the sessions from this conference. And it's been my privilege to be part of all of the Canada-India Network Society conferences, and first time virtually this year, and looking forward to the learnings from this meeting and welcoming everyone to the meeting as well. And thank you so much again for organizing this very important conversation.
Thank you very much, Dr. Lee. Another one of our founding partners is the university, Simon Fraser University, and Joy Johnson, CEO, president of Simon Fraser University, wasn't able to join us this evening, but she has sent a video. So we're going to play her video.
Hello, everyone. It is so nice to be with you this evening. My name is Joy Johnson, and I'm the president of Simon Fraser University. I'm privileged to be speaking to you from the beautiful unceded traditional territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam peoples. SFU is Canada's engaged university. Community engagement is at the heart of everything we do. We are so fortunate that our partnerships and presence in India have been guided by an Indian Advisory Council since 2006. The Council's members, including community and business leaders, government members, and honorary members, such as the Indian Consul General, provide insights and direction that help strengthen our collaboration and build meaningful relationships. One of the many ways we benefit from these relationships is knowledge sharing. The topic of this year's conference, Lowering the Burden of Chronic Diseases to Build a Healthy Civic Society, is an area of strength for SFU researchers. Many thanks to Dr. Aaron Garg and the Canada Indian Network Society for organizing this event. I look forward to the discussion and collaboration.
Great message there from Dr. Johnson from Simon Fraser University. Also from Simon Fraser University, a partner that has been with us right from the beginning and has been instrumental in helping us with our previous CINI conference, and we're very grateful. It is my pleasure to introduce to you Dr. Joanne Curry, Vice President of External Affairs, Simon Fraser University.
Great. Good evening or good morning, depending on where you are. It's so great to be with you tonight. And I must give I guess a personal thanks to Arun Garg for championing this initiative, for his vision and passion. I think most of us are here because he has developed this wonderful vision. And at Simon Fraser University, we've seen great benefits in terms of joint research projects that have begun with Indian institutions and researchers, and just really understanding more about some of the health issues, as well as integrative health approaches. As I listened to the previous speakers tonight, you know, when Meany mentioned about the trenches, I was thinking, you know, COVID has been a war, but I loved some of the other terms that were used about India, High Commissioner Bisaria, you know, India being healer of the world. And I think it's that compassion and work together and collaboration that's going to be so important. And I love the concept of an India-Canada health corridor, which is what we're trying to achieve and what the society and these conferences achieves. So I just wanted to congratulate Arun Garg. I can't believe it's been 10 years since Fraser Health and SFU helped to co-sponsor the first conference at the Surrey campus in 2010. I've enjoyed every single conference and seen tremendous benefits. Look forward to participating in the virtual conference and to talking to many of you in chat in the days ahead. So thank you.
Thank you, Dr. Curry. Yes, and the time do go by very fast, doesn't it? It's hard to believe that it was 10 years ago. Another one of our founding partners is BCIT, British Columbia Institute of Technology. And I'm pleased to introduce Kathy Kinloch, President of BCIT, to bring a message.
Thank you, Minnie, and thank you so much for the invitation. And let me join the chorus of congratulations to Arun. BCIT has been very, very pleased to be at the early stages of development and with you all along, and looks forward to the future as well. We are excited about the partnerships and the opportunities, and as well our relationship with Canada and India, as we work together to look at integrative thinking and our approach, how we approach healthcare. Over the next few days, I hope you'll hear from BCIT faculty who will share some of the initiatives that we've moved on over particularly during the COVID period, to bring together that integrative thinking and our self-awareness, as well as we identify systems and support systems that we need to move forward. So I'll be short and sweet and not repeat everyone else's, but it's great to be with many of you over the course of the next day or so. And as well, I really want to acknowledge the partnerships with all of you and recognize the opportunities as well that we've yet to explore together. Thank you.
Thank you, Kathy, for that message. And because, you know, we are about partnerships and collaborations, it is my pleasure to introduce Dr. Matthew Chow, President of Doctors of BC, and we're very pleased to have them as one of our partners.
Good evening and good morning to everyone. It's a real pleasure to be here tonight representing the doctors in British Columbia, all 14,000 of us. I'm joining you today from East Vancouver on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I also want to welcome everyone here who has an interest in discussing and learning about how we can ensure our healthcare system works for all British Columbians, especially our South Asian communities. I'm fully aware that the South Asian population in this province has been hit hard by COVID-19. Doctors of BC takes this to heart. To help counter this phenomenon, Doctors of BC worked with the South Asian Task Force on the This Is Our Shot campaign. The task force is comprised of volunteer physicians, researchers, and other professionals across Canada, but notably a dedicated group of doctors from here in British Columbia. This campaign addresses vaccine hesitancy and myths in the South Asian population and broader to all populations across the country to encourage as many people as possible to get their shot. As more people are getting vaccinated, the number of new cases is plummeting, and that trend is also being seen in South Asian populations as well. But we can't stop here. We know that chronic disease is also on the rise, and COVID has made this worse. As well, people are living longer. New medical interventions are being introduced to treat more chronic conditions. So how can doctors manage this? What is the healthcare system responsible for? What's the patient's role? How do we ensure that everyone gets the care they need? And how does virtual care fit in? We know that virtual care, for example, is here to stay. Team-based care, integrated care, all of it plays a big role. We are moving forward, working increasingly more in a team-based environment where each professional can work to their full scope of practice, where the goal is a healthcare system that works for everyone. And this includes paying attention to the unique healthcare needs of our South Asian communities. But going forward, there's lots to think about, lots to talk about, lots of decisions to be made. I look forward to this evening's discussions, and over the next few days, I expect great things from everyone and throughout the discussions. Thank you so much for having me. And again, welcome to all of you, and thank you to all the distinguished guests here tonight.
Thank you very much, Dr. Chow. And, you know, for highlighting that while there was a pandemic, but there's also some benefits that have come from that, like virtual care as an example. Moving on to one of our other partners is British Columbia, University of British Columbia. And joining us today to bring a message is Dr. Dermot Kelleher, and he's the Vice President of Health Sciences and the Dean Faculty of Medicine. Welcome, Dr. Kelleher.
Thank you very much, Minnie, and I'd like to also acknowledge that I'm joining today from the traditional ancestral unceded territories of the Musqueam, Squamish and Tsleil-Waututh peoples. Thank you to Aaron Garg and to the Canada-India Network Society for your leadership in convening this important meeting today. And it's so important to hear from His Excellency High Commissioner Bisaria about the importance of India to both vaccine development and to holistic models of health. Arun's an esteemed colleague and a faculty member in the Department of Pathology at UBC for more than 40 years. I'm very grateful to be part of today's conversation on how we can lower the burden of chronic disease through integrative thinking in health. This sort of an approach is crucial to the sustainability of healthcare. We're learning important lessons regarding integrative thinking in the course of the pandemic, and we must also ensure, as many of our speakers have already said, that the lessons learned are sustained going forward. I'm privileged to work at UBC's Faculty of Medicine, where we recognise that our contract with society, our focus on improving the health of the population, and our partnerships across the province and nationally and internationally are absolutely fundamental to our effectiveness in research and education. UBC is a recognised leader in distributed medical education, which is a real expression of our social contract. Now, returning to the integrative approach, Certainly, there are many lessons that we can take from the COVID pandemic that can be applied in the management of issues like chronic disease. But first, we must think about them at a population level, at a community level, at an individual level, at a cultural level. At UBC, we've learned a great deal already from Indigenous partners, in particular the FNHA, on the important concepts of health and wellness and the contribution of environmental, social, economic, psychological, and spiritual factors to health and disease. And implicit in this thinking are issues like culturally safe practices, respect, humility. And these concepts and their traditional basis are just as important to South Asian communities here in the Fraser. And most importantly, I would say, medicine and health are coming full circle to a point where we increasingly recognize the importance of this way of thinking. Keeping us well, preventing disease. And I'm really looking forward to hearing from Dr. H.R. Najendra on this subject. So let's be humble so that we can learn from these ancient Indian traditions. Let's be humble so that we can apply them through broader and deeper engagement with South Asians, patients and communities. We must find new ways to reach into the population and understand what the barriers might be. We've seen this with COVID, things like language or mistrust in the system, vaccine hesitancy. How do we get people to come forward for screening and treatment for chronic diseases, for the COVID vaccine? A great example of this type of engagement is by a fantastic UBC medical student, Sukhmeet Sachal, who saw the need to educate his community about simple ways to keep themselves and their families safe from the virus. And he crafted public health messages for the Sikh community in a culturally effective way. And together with his team of volunteers, distributed masks tailored to meet the unique needs of the community, empowering them to engage in their own health and well-being. So the UBC Faculty of Medicine looks forward to continuing these important discussions with the Canada-India Network Society and working with everyone towards our mission of transforming health for everyone. That takes an integrative approach. Thank you.
Thank you, Dermot. And as I was listening to you speak there, just really highlighting some of the themes that we've weaved in through this conference. And it's really looking for the best of the East and the best of the West. And I think that you've articulated that quite nicely. Moving on, we've also had a long-time relationship with Kwantlen Polytechnic University right from our beginning as well. And we have co-hosted conferences with them. It is my pleasure to introduce Dr. Allan Davis, President, Kwantlen Polytechnic University.
Thank you very much, and good evening and good morning, colleagues and friends. And a special shout out, if you don't mind, to my KPU colleagues in health and health sciences who are here tonight and will be over the next 2 days. It's just that I haven't seen them for a long time and I kind of miss them. KPU serves a region that includes the ancestral and traditional territories of the Hunkamanam and Senchothan speaking peoples, including the Kwantlen, who graciously bestowed their name upon this university. And I'm calling you tonight actually from the lands of the Semiamu people, right beside the ocean here in what we now call South Surrey. Dr. Garg, I salute you and your team for pulling together this important meeting. It couldn't be more timely. You're bringing together and integrating countries, cultures, ways of seeing and ways of healing in order to build a sustainable healthcare approach. Well done. And best wishes to everyone and good luck to you. And please enjoy and learn and engage over the next 2 days. And we all look forward to looking at the results and learning from what's going to happen. Thank you very much, Minnie.
Thank you, Dr. Davis. And one thing that you just touched on there, for some people that may be somewhat new to CINS and our CINI conferences, that is our approach, is that we do listen to all of the speakers and all of the conversations, and we use that as we're developing our strategies and our work plans as we go ahead. Moving along, one of our additional partners is the Institute of Health System Transformation and Sustainability. It is my pleasure to introduce Dr. George Abbott, the chair of the IHSTS.
Thank you. It is a great pleasure to bring greetings. Good morning and good evening, depending on where you're located in our world. I'm joining you from Greater Victoria, the capital city of British Columbia. It is also the traditional and unceded territory of the Lekwungen peoples, the Esquimalt and the Songhees, and I do thank them for the honor of being able to live, work, and play on their territories. The IHSTS has been a partner, a sponsor of this event for a few years. I really want to bring congratulations to all of the organizers, especially to my friend and former colleague at IHSTS, Dr. Garg. Congratulations on, again, putting together a great program. I've enjoyed the opportunity and the honor of attending this in the past, obviously in a live forum, and really enjoyed it. It's a great event, superbly organized, always useful for enhancing our understanding of health system challenges, and perhaps even more importantly than that, helping us understand what some of the solutions might be to the sometimes seemingly intractable challenges that face the system. The great thing about the Canada-India Network Society is that it builds understanding and cooperation. The importance of that understanding and cooperation has been very much underlined over the past now year and a half as we have faced the novel COVID-19 pandemic. It has never been more important to build international understanding than it is today. So again, good on you, Arun, and the team for bringing this event forward despite all the challenges inherent in COVID. Also wanted to thank Minister Adrian Dix for his very kind comments at the outset today, and I do want to congratulate him and congratulate Dr. Bonnie Henry on what I think has been excellent leadership for the province through the now long months of pandemic. So to all, best wishes on a successful conference. Undoubtedly, it will be so. And again, thank you for the opportunity of allowing me to speak this evening, and all the best.
Thank you very much, Dr. Abbott. And while he's coming to us from the chair of the IHSTS, he's been a supporter of this type of work for quite some time, going back to his role, his previous role as the former Minister of Health for British Columbia. And we are about partners, and we need to reach out into the community. So one of our partners that have been instrumental in helping us reach out beyond our healthcare community is MD Financial Management. It is my pleasure to introduce Pamela, Allan, the Executive Vice President, MD Financial Management.
Hello, everyone. I'm honored to join you today to say a few words on behalf of MD Financial Management and Scotiabank. We're proud and honored to be the platinum sponsors of this Canada-India Network Society Conference. We appreciate the opportunity to help organizations like yours deliver tangible results and lower the burden of chronic disease. From your society's very beginnings to present day, you've worked hard toward building a global, healthy, civil society. This past year has been particularly challenging for everyone, and we applaud your determination to continue to collaborate for a healthier Canada and India, even through difficult times. We also applaud your choice of topic for this conference, lowering the burden of chronic disease through integrative thinking. It's so important for all of us to remember that even in the midst of a global pandemic, other health issues continue to challenge our populations. I firmly believe that there's nothing more important than taking care of individuals like you who spend their life's work looking after the health and well-being of other people. That's why I'm proud to work for MD. We're the only national financial services firm that focuses solely on the unique needs of physicians and their family members. Today, we manage more than $57 billion on behalf of physicians, and along with our parent company, Scotiabank, we continue to look for and provide financial solutions that are in the best interests of our clients. So thank you for allowing me the privilege to speak to you today. May your discussions be enlightening and thought-provoking, and may we all leave this conference with a better understanding of the topic at hand. Thank you.
Okay, thank you to Pamela Allan for her message and for their ongoing support of the work that we do. While Pamela wasn't able to join us today, it is my understanding that she do have a few of her team members there. So welcome members from MD Financial Management. So that brings us to the end of our greetings from our partners and our supporters. And as you can see by all of the different comments that people made, and I have to agree with the theme of Dr. Garg. He works tirelessly. I have worked with him for several years now, and I don't know if I've ever come across anybody that has the level of energy that he has and the spirit that he brings to everything that he does. But he would be the first one to tell you that it's not something that he can do alone. And it is through these conversations and these partnerships and these relationships that we develop both locally here in Canada, in India, and globally that allows us to start shifting that conversation from traditional ways of approaching medical care. We're very, very pleased that all of you have been able to join us and to support our work over the past years, and we look forward to the years as we go forward.